welcome to today's workshop on neck pain and stiffness. My name is Julie Briand-Sleigh. I'm one of the physiotherapists here at ProTX Services. So we have a multidisciplinary clinic. We have locations Lower Sackville, Elmsdale, and here in Portland Hills and Dartmouth. And we offer chiropractic, physiotherapy, and massage services. So my goal today is to share with you the most common cause of neck pain and stiffness and how to manage and start resolving your neck pain. So neck pain is one of the top 5 chronic pain conditions in the world. Almost impossible to estimate how many people have it. But back in 2017, there was a global study done in North America. 20 million people had it at the time, and 4 million people had new cases of neck pain in 2017. So tons and tons and tons of people. So just to give you an idea, when someone has neck pain and it just started, there's 3 likely pathways. About 45% of people, it's going to be mild and people are going to recover really rapidly. Another 40%, it's going to be moderate pain, and maybe there's going to be some leftover things at the end of your recovery. What I wanted to emphasize with this is that the total of that is 85%. 85% of people can recover fully or with just a little bit of issues remaining. So there's no need to think right now that your neck pain is there for life. There's definitely recovery possible. The majority of recovery does happen in the first 6 to 12 weeks. So what that tells us is the faster you can start getting treatment or you do things to help yourself, the better. Because after 12 months, recovery significantly slows down. If you have chronic pain, so pain that's been around for years, comes and goes, or maybe it's constant, the same thing applies really. The earlier that you can get treatment, the better. Okay, so neck pain, like many pains throughout our body, neck pain is a multifactorial problem. It's just not one thing, it's just not our body. And these are a lot of the risk factors that research has shown plays into neck pain. So if you haven't been in a car accident or something and it's just gradual onset, the older you are, the more prone you are. A lot of research has shown that if you're female, that can put you more at risk. If you're doing a job or if you're doing things at home where you're in really awkward and sustained positions, that can take a toll. If your job includes a lot of heavy lifting or repetitive lifting, and at the opposite extreme, if you have a job that's very sedentary or you're very sedentary at home and you don't do much physical activity. If you're on your computer, and we're not talking a little bit, we're talking about hours and hours a day, every day. That can make a big difference. As well, if you had previous pain, and then the psychosocial factors, and that's stress. So many of us have so much stress in our lives right now, and a lot of us don't actually deal with our stress. We just put up with it. So stress, anxiety, depression, lack of social support from those around you, family and friends, that takes a huge toll on our bodies. And I think it takes a much larger toll than many of us think, because our bodies react to stress, especially when it comes to the neck and the shoulders. I know that's where I keep my stress. People tense. You walk around all day and your neck is tense and your shoulders are tense and you carry that stress in your body. So that's a huge, huge factor. I've had multiple clients that until they were able to deal with their stress, they couldn't actually get better because of the impact the stress had on their body. So that's a big one. All right. And some risk factors when it comes to your pain sticking around and not resolving in that 6 to 8 weeks we talked about. After a car accident, for example, the risk factors are if you're in a lot of pain, if you're really sensitive to the cold, if because of your pain and your stiffness, you're feeling quite disabled, you're not able to go back to a lot of your normal activities, or you're not willing to try them. If you're having a lot of post-traumatic stress issues from the accident, and you're thinking you have catastrophic beliefs, which is you're not being totally objective about what happened to cause your injury, but you're making it bigger than perhaps it actually is. And that can have a huge impact on whether your pain sticks around. When it comes to something else other than an accident, so gradual onset pain or gradual pain that started at work, the older you are and your previous history of pain can make a difference. So I'm going to throw out another poll there. I'm going to go to poll number 2. So if a person is in a car collision, do you think the position of their head, neck, and or body might affect which injuries they have? Because this is an interesting one. I wanted to talk about this because a lot of people, when they come in with after a car accident, everyone typically talks about what they were doing, how they were turned. So I'm curious as to your thoughts. All right. Perfect. All right. So the answer is, it doesn't really. So the research has looked at all the factors, and after a car accident, the direction of the impact, how you were sitting, your awareness that it was coming, having a headrest, whether you were moving a bit or stationary, and the shape of your neck as well, whether you have like a more of an arch or you're really flat, all those things don't actually make a difference. It goes back to the previous page, the other risk factors and how you're thinking about it and your increased pain and your beliefs about your pain and how you're going to get better. Those make much more of a difference than what objectively happened at the time of the accident. All right, most common cause of neck pain. So by and large, the most common cause of neck pain comes from your soft tissue. So we're talking muscles, tendons, ligaments, sometimes every once in a while bursas, so other soft tissue structures that are in and around your neck. And the reason why I wanted to show you these images is because of the fact that the anatomical structure which causes your neck pain isn't necessarily always identifiable, because if you look at these images, we have so many muscles. In the front, there's multiple layers, and in the back, so many layers as well. In addition to all these muscle layers, we also have all the joints as well. So a lot of our neck muscles, not only is it just the neck, it comes down and they attach onto the collarbone. They attach onto the shoulder blade in the back, if you can see from the picture on the right. They attach onto the ribs. They attach onto the back, all the way down the back to almost the low back. So all of these things are going to impact your neck pain. Because if you take a look at the picture on the right, that muscle, that's our lat, that's going all the way down. No, that's not our lat, sorry, that's our traps. Our traps are going all the way down our back. If something's happening with our back, if our back is really stiff or something else is going on and that's causing that muscle to be tight or to be angry, to be irritated, that's not only going to make an impact on the back where the muscle attaches, but at the other end of the muscle. So a lot of these muscles, they attach down lower on our body, but they come up and they originate near our neck area. So stiffness at the shoulder blade, stiffness and the ribs, stiffness in the chest, that can all impact the neck. Okay, now so the common case is when it's just a soft tissue issue around the neck. Serious cases when it comes to neck pain are very, very rare. And usually when you go to therapy or when you go to your doctor, if you do have if you do have symptoms that are indicating that it might be a possibility that there's a more serious issue going on, the clinician or the doctor is going to do a neurological screen. And when it does come to surgery, sometimes people will get surgery for cervical radiculopathy or for myelopathy with an issue with the spinal cord, or sometimes for facet arthropathy, which is a type of arthritis that happens in some of the joints. But the research has shown that surgery, while it's more effective in the short term, it is not in the long term. In the long term, you're looking at conservative management. And when I say conservative management, that is therapy, that is physical therapy, that is chiro, that is massage, that is doing exercises at home, addressing the risk factors that we talked about earlier, your stress and your habits as well. So all of these things, that is what creates the best long-term outcome for you. So there's absolutely situations where surgery is required, but even in those situations, usually the doctor and the surgeon is recommending that you go home and you do the conservative measures first. All right, so this moves us on to what is normal. So a lot of clients come in and they will tell me that they have a degeneration, they have arthritis in the neck. And as a clinician, that while it's great to know that, it doesn't make a huge impact on our care, because we expect that, I should say, the research has shown that almost 50% of people have degeneration. It's a normal fact of getting older. As you can see on the left, that's a 2 vertebrae of our neck, and you can see the disc in between. And then on the right, you can see how the degeneration might progress. So the thinning of the disc, the bony changes on either side, that's completely normal. A lot of people are going to have those changes as they get older. So I expect when people come in to the office and get assessed, I expect that the person I'm seeing probably has changes, but that doesn't actually impact the care that we give, because we're looking at improving your range of motion and your strength and your flexibility and your endurance. We're looking at improving all those things, despite the fact that you might have arthritis in there. And then when it comes to imaging, you might have experience with yourself or with friends and family members that maybe they had pain and they went to their doctor, and perhaps their doctor really didn't want to get them imaging, or they were very hesitant. And one of the reasons for that research has shown that X-rays, CT scans, MRIs, they do not correlate well with the pain that people actually experience. And because they don't correlate well, they don't have good prognostic value, which means they're not going to tell the doctor or the clinician what the likelihood of your pain going away is, or how long it's going to take. That relationship just isn't there. So that's why doctors are probably, when it comes to the neck, unless there's some red flags happening that we talked about earlier, unless there's a red flag, then you probably won't get imaging. All right, and this is just another quick view. This is a cross section of one of your cervical vertebrae with your disc, because I just wanted to point out that there's multiple little locations where you can get degeneration. We have a lot of little joints in between the vertebrae, and also disc bulges. That is part of degeneration. A lot of people have disc bulges and don't even know it because it's not causing them any pain. All right, another thing I wanted to make you aware of is referral pain from muscles. So sometimes we'll get people coming into clinic and they're really worried and they're really stressed because they're having pain that's going down the arm. They're having numbness, they're having pins and needles that go down the arm. And as soon as people feel that, they think that, okay, it must be something to do with my neck and my spinal cord and my nerve roots, or maybe it's cervical radiculopathy. That would be rare. The most typical case is that it's actually coming from your muscles. So our muscles have referral patterns that can go a long distance from where the muscle actually is in our body. So on the left, you can see this is a couple examples of your rotator cuff muscles, which are around the shoulder blade. So on the left, the little green up at the shoulder blade area, that's the muscle. The red on the picture right beside it is the pain referral pattern. It goes all the way down the arm, even to the back of the wrist. On the right-hand side, same thing. One of your rotator cuff muscles, and the pain is going to your shoulder, outside your shoulder, and going all the way down your arm and the front of the arm as well. So just if you are feeling pain down the arm, it's not necessarily anything serious, could just be soft tissue and musculature. This is another example. This is a picture of your scalenes, which are on the side of our neck. For a lot of people, these guys are tight, and they're tight because of stress. They're tight because of weakness. A lot of people have weak necks. A lot of people are very stiff. So these guys can get really tight. And when these guys are tight, they can radiate pain down the front of the chest, down the back beside your shoulder blade, and down the arm as well, even into the hand. Furthermore, some of our neck muscles can create headaches. So on the left, it's a picture of our traps. So the muscle that sits right on the side here, where a lot of people have tension and a lot of people have pain. When these guys aren't happy, they can go right up over the ear, into the head, behind the eyes and the forehead. On the right, the muscles that we're talking about here are the muscles right at the bottom of your skull. We have so many little muscles in there. And a lot of people, especially people that work at computers a lot, these guys can get really, really tight. And when they get tight and angry, not only would you have neck pain, it can also create the headaches on the side of the head, and again, forehead and behind the eyes. And then third, another neck muscle, this big guy on the side of your neck, it's called your Sternocleidomastoid. On some people, this guy can get angry and tight, and that refers up into the head as well. And this time is going to be a really good plug if you do suffer from headaches as well. We are doing another presentation in 2 weeks from one of our chiropractors that is going to talk about headaches. I think Kate will be able to give you the full name of that presentation at the end. Okay, so with everything said so far, conservative management is the way to go. Therapy is the way to go. So just to let you know what it looks like if you haven't had therapy before, when someone comes in and has an assessment here at ProTX, it's an hour block, and we spend the first part of that doing a subjective assessment. So we're asking you all about your pain and what aggravates you and what makes you feel better and your habits and your sleep posture and your stress. We're trying to take a look at the big picture and the small picture of your neck to make sure we're going to be looking at all the factors. The second part of that assessment is going to be an objective assessment where we're assessing your range, we're assessing your strength, we're assessing your stiffness, and we're not just looking at your neck, but we're looking at your shoulder girdle and your shoulders and your shoulder blades and your back, because like we talked about earlier, all these things impact your neck. It's never just about your neck. So if you haven't had therapy, or maybe you already have a therapist, make sure that during your treatment, you are working with your therapist on addressing your personal risk factors that we talked about earlier. So your thoughts about whether you'll be able to get better or not, the time that you spend at your computer, if you have a job where you're spending lots of time in awkward positioning, stress, all these things, talk about it with your therapist and see. We have lots of little tips and tricks to help address those factors and make things better for you. And then ideally, you and your therapist are going to come up with a plan that is specific to you, because we're all different. Our bodies are different, our lives are different, our work is different. So you want a specific plan that is unique to you. So big picture. If you have pain right now, which it looks like all of you do not need to live with that. You can seek treatment, and at the very least, you can significantly improve it. However, it comes with a caveat, which is commitment. When we see clients perhaps, depending on the scenario, sometimes it's 3 times a week, twice a week, once a week, and it's maybe 45 minutes, an hour at a time. What you do outside of the clinic is what wins the war. What you do if you're doing your exercises, if you're paying attention to how you're sitting, if you're spending too long at the computer without taking stretch breaks and movement breaks, your sleeping position, everything that you do at home is what matters most when it comes to your neck pain. All right, so now what does conservative management look like for you? So I'm going to go through some general guidelines for the majority of people that come into the clinic. Okay, so for someone that's acute, maybe it just happened and it's the first 48 or 72 hours. You want to find a position of relief. So for any injury, finding a position where you can significantly reduce your pain or you have no pain is important, because going through the whole day without pain is horrible. and it's not helpful for getting better. So you want to make sure you have a way to manage it. And maybe that's with heat or ice as well, or it's with muscle relaxants or anti-inflammatories, which you should use in consultation with your pharmacist or your doctor. The other thing we suggest if an injury has just occurred is definitely make sleep a good priority. And when we talk about good sleep, I talk about neck positioning, and we'll go through that a little bit later. I have a slide for that. We also suggest that you pace yourself. So don't go to bed and stay there for a couple of days. Move around, take breaks if you need to, do some things around the house. Be gentle with yourself, be kind with yourself, but do move. And when you move, you don't have to go into pain, but use what you have. If you're finding that your neck is really stiff, but you still have a little bit, use what you have. Because what can happen is when we get hurt and when we're in pain, we're scared to move. But if we don't do any movement at all, we get stiffer. If we don't use the movement, if you've ever heard the saying, you use it or lose it, that's pretty true when it comes to the body. Our bodies were made to move. And if we don't move, we stiffen up. And if we stiffen up, it's not just the joints, it's the muscles, it's everything. And then generally that contributes to our pain as well. So use the movement that you have. When it comes to heat or ice, generally stiffness. If your neck is stiff, heat's great. If you're getting headaches from the neck pain or with the neck pain, or if it's more sharp pain or nervy pain, I find ice is really helpful for people. Relaxation techniques. If a lot of people, we have so much stress in our lives right now, and a lot of people don't do anything to actually address that stress. So I would very much suggest that if you have stress in your life, if you do feel your body reacts to that stress, try to figure something out, whether it's a little bit of time each day, 5-10 minutes of deep breathing, or meditation, or prayer, or some further techniques like progressive muscle relaxation. Whatever it is, find a technique that works for you. Maybe it's even walking outside in the woods. Doesn't matter what it is. It just has to be relaxing for you, and that is so important. All right. So this is the slide I was talking about earlier in regards to sleeping. So if you sleep on your stomach, please stop. That is generally a neck symptom aggravator, because our necks do not like to be torqued all the way to the side when we're on our stomach. So normally what I suggest in clinic is to sleep on your side or to sleep on your back. When you're sleeping on your side, you'll see the pictures on the right. You want to find a pillow that takes up the space between your head and the outside of your shoulder. So you don't want a thin pillow where you're scrunched, and you don't want a thick pillow where it's pushing you up. You want somewhere in the middle. You can also use pillows in front of you to support your upper arm. That helps take away stress from the neck. Or you can put a pillow on your side and rest your upper arm on that. By supporting the arm, by supporting the shoulder, you're going to take pull away from the muscles at the neck, and that helps. If you're on your back, thinner pillows are generally better, and pillows underneath your knees can help. All right. I think I missed, yeah, I just realized I missed a poll from earlier. Oh, well, okay, moving on. So those are things that you can start doing on your own. When you come into clinic, this is what the research has shown that we should be doing. So one of the top physiotherapy journals, they put out clinical guidance reviews every so many years. I believe the one I looked at was from a couple years ago, 2019, and it's a huge review of all the research to date, and then it summarizes the best research and says, this is what we should do. So according to the research, this is what you should be getting if you're having neck pain. Education and recommendations regarding sleep, stress, and gradual return to normal activities. Reassurance, there's probably nothing serious going on in the majority of cases. You should be getting manual therapy. And there's better evidence for the back than there is for the neck. So like we talked about before, the back plays a huge role in what the neck is feeling. So if you're stiff, that's going to impact. So therapy has to address the back as well. Range of motion exercises, and then strengthening and stability exercises for the shoulder back area. So scapulothoracic is where your shoulder blade connects to your upper back. So that needs to be strengthened, and that also needs to be mobilized in order for your neck to have a great foundation and to be able to get through the day without any pain or issues. Laser is also helpful. Another thing to start off with is laser if someone's having a radicular pain, which is pain down the arms. All right, so I have a quick little video to show for one of the initial exercises for range of motion I give people. So when a couple days after a car accident, I usually send people home with this exercise. And it's not necessarily that it's going to make you better, but it's going to use the range of motion that you have and prevent you from getting stiffer and prevent you from snowballing. So it's super helpful to do this exercise just within the range of motion that you do have without pushing into pain. All right, another exercise we typically give people right off the bat is it's a strength, stability, and range of motion exercise all in one. What this gentleman is doing is literally he's nodding his head. And this mobilizes the joints right up at the top of your spine, right underneath your occiput. So there's a couple vertebrae in there, and that vertebrae does the nodding motion. And that gets so stiff and so tight on some people, and it's definitely a pain generator. So just doing this little nodding motion without involving the rest of the neck can strengthen the deep flexor muscles that do that motion, as well as mobilizing the area. And then another exercise I tend to send people away with is a breathing exercise, which is lateral costal deep breathing. And the reason I give people this is because the majority of people that I've seen over the last 4.5 years of practice, they breathe apically, which means their neck and shoulders, they take deep breaths like this. So they're overusing the neck, they're overusing the shoulder muscles. And these muscles are actually secondary muscles. It's actually the muscles down around in the ribs, the diaphragm, the intercostal muscles, those are our primary breathing muscles. These ones are secondary. So we shouldn't be using these on a regular basis. So I give this exercise to help promote proper breathing. And so these guys aren't getting used throughout the day. And if they're not getting used, then they actually have the ability to relax. And then they're going to be less likely to be a pain generator for you. All right, I just have to get back to my screen here. Okay, so the next portion, what you do after the first couple of days. So this next section is called the subacute time. It's the first 6 to 8 weeks. So what you're looking to do is you're looking to progress those range of motion exercises to different locations. You're also going to further reintroduce activities of daily living. So maybe it's, cleaning around the house, maybe it's getting down on the floor, playing with your kids, going for walks. Those are the things you want to get back to. And the main idea, like when people come in and they're like, what should I do and what shouldn't I do? There's no really barrier to going back to anything. But what you want to do is look at the activity and think, okay, is this maybe a bit harder on my body? Maybe I should try the easier things first and see how they go. Because you're really not in danger of damaging your tissue further. Tissues heal in the first 6 to 8 weeks after, if they actually are damaged. Usually what people are dealing with is tight, contracted muscles, tendons, stiffness, and that's generating the pain. So by going back and doing things, you might aggravate them, you might flare them up, but you're not going to damage them. So when we're looking at getting back to activities, Don't be scared, just be careful. Consider what you're doing, do the easier things first, take breaks as you need to, maybe put off scrubbing the tub or the toilet or, washing the floor, maybe, or vacuuming, maybe put those off until you've tried the easier things, but don't be scared. Avoid prolonged or painful activities. Again, you want to keep your pain under control. Getting your pain under control is such an important step and should be the first step when it comes to getting better and care. You need to find a way to, whether it's through the medication, the exercises, the position of relief, you want to find things that help your pain better. So when you get aggravated, you can resort to those activities so you're not in pain all the time. Keep using heat and ice, keep using those relaxation techniques we talked about earlier, and keep getting good sleep. What you're going to have when you come into clinic, you should be getting neck strengthening and stability exercises. A lot of people are weak in the neck and don't even know it. So we should be strengthening your neck. We should be giving you, progressing your exercises to strengthening your shoulders, your shoulder girdle, your upper back. We should be giving you endurance exercises, because the neck, by and large, we're not doing huge, resistant motions with the neck. The neck is endurance. It has to hold our head up all day. So endurance exercises are really important. And again, manual therapy on the back and the neck. So another example of a range of motion I would typically give people in that first little bit, shoulder rolls. They're easy. Well, they're not easy. They're simple. A lot of people, every once in a while, some people has a really easy time, but by and large, people have difficulty, especially if they try one way and then they try the other way. Usually one way is more difficult. Shoulder rolls, why they seem simple, they're fantastic, because rolling your shoulders moves the shoulder, the clavicle, the ribs, the shoulder blade. It's moving everything that your neck muscles come down and attach to. It's getting that moving. It's getting those muscles moving. And if you can mobilize everything else, that's going to help your neck. Another quick exercise that I typically give, if people are tight up at the top of their neck, I'll give people this exercise, which is just a rotation exercise for the upper neck. Most of our rotation, about 45 degrees of our rotation, actually comes from that upper neck area. So isolating that can be very helpful. Okay, and then we add in range of motion exercises for the back. Probably most people are familiar with cat-cow on the left, and then on the right is a thread the needle exercise. So it works on mobilizing your ribs and your thoracic spine into rotation. So that can be, I give that to so many people for helping to mobilize the back and upper back especially. Another great exercise for activating and strengthening the muscles in your back is squeezing your shoulder blades together and then pulling them apart. Some people, this is super easy. A lot of people, very, very difficult. It's always fun to try this and then to ask the people around you if they can do it too, because it can be tough for people to isolate just the shoulder blades without actually moving your back as well, just the shoulder blades. Okay, now when it comes to individuals that your pain is chronic, it's been years, it's been a decade, maybe it's been months, it comes and goes, or maybe it's constant. Generally, maybe you didn't get appropriate care at the beginning. Maybe the care that you got didn't address all those factors. Or maybe it's a little bit more complex. Maybe they did address multiple factors, but maybe not quite enough. Or sometimes there's some stiffness or some unresolved issues that go back to the beginning. So usually someone comes in, someone is chronic, multimodal treatment approach. So all the risk factors that we talked about, all the things that can impact your neck pain, about your life, your lifestyle, your habits, and your body itself, everything has to be looked at. Because when it comes to chronic pain, it's definitely never just one thing. It's always a bunch of things together that they all make a little bit of difference. There's a lot on this page, and I know that. but it's just a snapshot. When someone comes in and tells me that they've had pain for years, months, it's been a long time. The research has shown that this is what we should be doing. Manual therapy, neck and back, so many different exercises, strengthening, endurance, but also adding in proprioception and coordination, posture training, endurance training. We also add in aerobic conditioning, how you're thinking about your pain. Where modalities, we're also, bringing in dry needling, laser, traction, sometimes TENS. We're doing a lot of different things to help your neck pain. And then there's also education regarding pain management. Maybe you don't have good pain management. Return to active lifestyle and identification of all those little habits throughout the day that could be contributing to your pain. For example, do you read? Are you a book reader and do you love to lay on your side and read your book with your neck tilted? Do you have a TV in your bedroom? Do you lay on your bed, kind of half propped up and watch the TV? That's a huge no-no for the neck. Do you sleep on your stomach? How do you work? How do you do so many things? That can make a difference. So those habits need to be addressed as well. Okay. So coming to the end here, takeaway points. You do not need to live with your neck pain and stiffness. Most people recover. However, there's work involved. You have to commit. And you have to commit to taking the time every day to doing what you need to do to address all those factors, the risk factors, your habits, your sleep, your stress, and doing the exercises. And if you're getting treatment or you're looking to get treatment, it should be multimodal and multifactorial, addressing all the things we talked about, not just, okay, this hurts here, let's work right here. So work with your health provider for creating a personalized plan. Our therapists here at ProTX Services would love to help you if you don't have a therapist already. We have openings for assessments that are quickly getting booked up, so I would suggest booking right away if you're looking for some care. We would love to help you, whether it's chiro or physio. We would love to help you out with your neck pain. Thank you very much for joining us today, and we're going to open up the chat, I believe, to see if there's any questions.